The chair recognizes the gentlewoman from Florida, Ms. McCormick, for 5 minutes.
Madam Chair, I rise to applaud my colleagues for passing the Affordable Insulin Now Act, which will lower costs for hardworking families by capping the out-of-pocket costs for insulin at $35 per month. This legislation is about putting the health of our citizens before profit. Rising by 54% from 2014 to 2019, the cost of insulin has created an affordability crisis for the 9.8% of Floridians living with diabetes, which is roughly 2.8 million residents. Nobody should be forced to choose between paying for rent and protecting their health. More than half of the Americans have less than 3 months' worth of expenses covered in an emergency fund. The total includes 1 to 4 Americans who indicate having no emergency fund at all, up from 21% in 2020, let alone to have the ability to pay more than $300 for a single vial for those without adequate insurance. While the Affordable Care Act has ensured access to health care for Americans, however, the cost of health care remains far too high. This legislation will ensure the Floridians with diabetes pay no more than $35 for their life-saving insulin each month. My constituents in Florida's 20th Congressional District feel the effects of rising out-of-pocket costs for their insulin. This bill provides them with the appropriate relief in a time when families are struggling to make ends meet. Americans currently face an average price of $98.70 for a unit of insulin, 10 times higher than in other wealthy nations. 1 in 4 Americans who rely on insulin have been forced to ration doses due to high prices, at last resort within potentially fatal consequences. Uninsured people in the United States are disproportionately from Black, Indigenous, and other communities of color. For those who do not qualify for Medicaid, high insulin prices can be devastating, forcing them to make impossible choices between covering different basic needs. Unfortunately, throughout the United States, diabetes prevalence has increased over the past 2 decades, disproportionately affecting low-income populations. Even with health insurance, particularly high-deductible health plans, people can face exorbitant copays and fees that make their medicine unaffordable. Once the Senate votes in favor of this bill, beginning in 2023, private health plans shall cover at least one of each type of dosage form of insulin and cap cost sharing for a 30-day supply at the lesser of $35 or 25% of a plan's negotiated price. Among individuals with private insurance, half would save at least $19 per month, and a quarter would save at least $42 per month. Individuals who buy their own insurance will experience the most savings. This legislation comes as House Democrats continue working to advance comprehensive reform addressing the high cost of prescription drugs. I'm committed to ensuring that we continue to protect the health of all Americans. I strongly urge my colleagues in the Senate to pass this critical bill. Thank you, Madam Chair,